Have you ever noticed that your parents or grandparents frequently scratch themselves, sometimes even tossing and turning in the middle of the night due to persistent itching? At first, you might think it's just dry skin, the result of dry weather, or simply an unconscious habit. But as time goes by, the itching doesn't go away. In fact, it worsens, causing discomfort, sleep disturbances, and significantly affecting their quality of life. We often overlook these signs, assuming that itching is normal for aging. However, chronic itching in the elderly isn't always just a dermatological issue. It can sometimes be a symptom of an underlying serious health condition. Diseases such as kidney failure, liver disease, diabetes, neurological disorders, or even cancer can lead to prolonged itching. If not detected early and treated promptly, this persistent itching can disrupt daily life and pose a risk of more severe complications. Instead of dismissing it as a minor symptom, pay close attention, ask questions, and encourage your loved ones to seek medical checkups if the itching persists unusually. Sometimes, what seems like an insignificant sign could be an early warning of serious health issues we might not anticipate. In today's video, we will help you identify 5 areas on the body where persistent itching could indicate underlying health concerns. Don't overlook what may seem like harmless itching. Sometimes it's your body's early signal of hidden disorders. By understanding these signs, you can take proactive steps, seek timely medical advice, and prevent potential health risks before they escalate. Stay with us until the end of the video because, in addition to highlighting the most commonly affected areas, we'll also explain how early detection can make a significant difference in maintaining long-term health. You'll learn to recognize common symptoms, identify key warning signs, and understand when to take your loved ones to the doctor for proper evaluation and treatment. This video is especially valuable for those caring for elderly family members. At this stage of life, the immune system weakens, and the body no longer responds to illnesses as efficiently as before. Recognizing early warning signs doesn't just help minimize complications. It also ensures that your loved ones receive the best possible care, improving their quality of life and maintaining stable health in the years to come. By understanding these crucial signals, you will be able to make informed decisions to protect the health and quality of life of your loved ones. Recognizing early warning signs helps you become a more attentive caregiver and prevents serious complications that may arise in the future. A small action, a careful observation today, can provide peace of mind and ensure that your loved ones receive the best care when they need it most. With the insights we're about to share, you can help improve your family members' comfort, safety, and overall well-being, especially the elderly. Don't miss this important information. Health is our most valuable asset. Start by equipping yourself with the knowledge necessary to protect yourself and your family from potential health risks. If you haven't subscribed to our channel yet, hit the subscribe button today and turn on notifications so you won't miss any valuable content in the future. Your support greatly motivates us to continue providing meaningful knowledge that helps build a healthier community. If you find this video helpful, don't hesitate to like it and share it with your friends and family. A small action from you could help many others become more aware of potential health risks they may be facing. 1. Itching at the back of the neck, a warning sign of spinal issues. If you notice that your loved one frequently scratches the back of their neck or complains about persistent itching with no apparent cause, don't dismiss it as a minor issue. In reality, prolonged itching in this area can be a warning sign of serious conditions related to the cervical spine or nervous system, particularly cervical spondylosis or nerve compression. The cervical spine plays a crucial role in supporting the head and protecting the nerves extending from the brain to the entire body. Over time, due to aging, injuries, or poor posture during work and daily activities, the cervical vertebrae can degenerate, weakening the spinal structure and leading to nerve compression. When this happens, the affected individual may experience pain and other symptoms, such as persistent tingling and discomfort at the back of the neck. Particularly, if the itching is accompanied by symptoms such as headaches, dizziness, neck stiffness when turning the head, or numbness spreading to the shoulders and arms, the underlying cause could be cervical disc herniation or nerve root compression syndrome. When nerves are damaged, they don't just cause itching. They can also impair mobility, making everyday activities like driving, working on a computer, or even sleeping more difficult. If left undiagnosed and untreated, this condition can lead to more serious complications, including muscle weakness, loss of balance, or chronic pain. Therefore, if you notice a loved one experiencing unusual itching at the back of the neck, pay close attention to any accompanying symptoms and encourage them to visit an orthopedic or neurologist specialist for a thorough evaluation. Early diagnosis helps pinpoint the exact cause and enables timely treatment, preventing dangerous complications. Various approaches, such as physical therapy, posture correction, or even gentle exercises, can significantly improve this condition, allowing the affected person to live a more comfortable and fulfilling life. Always pay attention to even the smallest signs in the body, as they may serve as early health warnings that should never be ignored. 2. Itching in the chest and upper body, a warning sign of heart or lung issues. Persistent itching in the chest and upper body isn't always just a skin issue. It can sometimes be an early warning sign of serious internal conditions, particularly those related to the heart and lungs. The circulatory and respiratory systems transport oxygen and nutrients throughout the body, sustaining vital functions. When either of these systems experiences problems, the body may signal distress through various symptoms, including persistent chest itching, which many people overlook. If this itching is accompanied by shortness of breath, chest tightness, rapid heartbeat, dizziness, or unexplained fatigue, it could indicate cardiovascular conditions like heart failure, arrhythmia, coronary artery disease, or hypertension. Poor blood circulation can lead to fluid buildup or oxygen deprivation in tissues when the heart doesn't function efficiently, resulting in persistent, unexplained itching. In addition to heart-related issues, lung diseases can cause itching in the upper body due to respiratory difficulties in delivering adequate oxygen. Conditions such as pneumonia, chronic obstructive pulmonary disease, COPD, asthma, or even lung cancer can impair lung function, disrupting the oxygen exchange process in the blood. When oxygen levels decrease, the skin may become more sensitive, leading to persistent itching without an obvious cause. If your loved one frequently complains about itching in the chest area without a clear reason, pay close attention to additional symptoms such as chronic cough, chest pain, unexplained weight loss, pale skin, or bluish lips. These could be warning signs of serious health conditions that require early medical attention. Encourage them to consult a cardiologist or pulmonologist for a thorough examination and accurate diagnosis. Early detection helps prevent dangerous complications and increases the chances of timely treatment, improving overall quality of life and safeguarding long-term health. Never underestimate minor symptoms. Sometimes, a small act of concern at the right moment can make a significant difference in the well-being of your loved ones. 3. Itching in the lower back and hips, a warning sign of kidney disease or nerve damage. Persistent itching in the lower back and hip area isn't just a fleeting discomfort. It could be an important warning sign of serious underlying health issues. This condition is often closely linked to two primary causes: kidney disease and spinal nerve damage. If your loved one frequently complains about itching in this area without a clear cause, consider the potential risks outlined below. The kidneys play a vital role in filtering blood, removing toxins, and maintaining the body's balance of water, electrolytes, and essential minerals. This function helps regulate blood pressure, supports red blood cell production, and ensures that all organs operate efficiently. However, when kidney function declines, the body's ability to eliminate toxins is impaired, leading to toxin buildup in the bloodstream. One of the most common symptoms of this condition is persistent itching, particularly in the lower back, where the kidneys are located near the spine. Kidney dysfunction often has no obvious symptoms in its early stages, leading many people to overlook it. However, suppose persistent itching in the lower back is accompanied by other symptoms such as swelling in the legs, ankles, or face, prolonged unexplained fatigue, loss of appetite, dull skin tone, or changes in urination. In that case, the likelihood of kidney disease increases significantly. These urinary changes may include decreased urine output, frequent nighttime urination, foamy urine due to protein leakage, or dark-colored urine, deep yellow or brown. These signs indicate that the kidneys are struggling to properly filter and eliminate waste from the body. If left undiagnosed and untreated, kidney dysfunction can progress to chronic kidney disease or end-stage renal failure, severely impacting overall health. At this stage, patients may face life-threatening complications such as high blood pressure, anemia, osteoporosis, cardiovascular disorders, and the potential need for dialysis to sustain life. In addition to kidney-related issues, persistent tingling or prickling sensations in the lower back and hips could also be signs of spinal nerve damage, particularly due to conditions like herniated discs, spinal degeneration, or sciatic nerve compression. When a spinal disc becomes damaged or deteriorates, it can put pressure on surrounding nerves, causing sensations of itching, numbness, or even pain that radiates down to the buttocks, thighs, and legs. This can make it difficult for individuals to stand for long periods, walk comfortably, or bend over, significantly affecting mobility. Pay attention to additional symptoms if your loved one frequently experiences itching in the lower back and hip area. Signs such as swelling, persistent fatigue, urinary changes, lower back pain, or numbness extending to the legs should not be ignored. Encourage them to seek medical evaluation from a nephrologist or a spine and neurology specialist for accurate diagnosis and timely treatment. Early detection helps prevent serious complications and allows for better disease management, improving quality of life and ensuring long-term health. Never underestimate unusual signals from the body. Sometimes, a timely act of concern can significantly protect your loved one's well-being. 4. Persistent itching in the hands and wrists, a warning sign of arthritis or circulatory disorders. If your loved one frequently experiences itching in their hands and wrists without an apparent cause, don't dismiss it as a minor issue or a normal bodily reaction. In many cases, this condition may be an early warning sign of more serious health problems, particularly arthritis or circulatory disorders. Arthritis, especially rheumatoid arthritis, RA, or osteoarthritis, is one of the most common causes of persistent tingling or itching in the hands and wrists. When the small joints in these areas become inflamed, they may swell, feel warm to the touch, and cause pain while also affecting nearby nerves. This nerve compression and irritation can result in prolonged itching, numbness, or tingling, making the person feel discomfort even with no visible skin issue. If your loved one experiences frequent hand itching, joint swelling, morning stiffness, difficulty moving, or pain when gripping objects, they may suffer from some form of arthritis. Rheumatoid arthritis is an autoimmune disease that, if left untreated, can gradually damage joint cartilage over time, leading to permanent joint deformities. Meanwhile, osteoarthritis is a degenerative condition caused by natural aging, where joint cartilage wears down, resulting in chronic pain, stiffness, and reduced mobility. Beyond arthritis, poor blood circulation can also cause persistent itching in the hands and wrists. When blood flow is inadequate, the tissues in the hands may not receive enough oxygen and nutrients, leading to tingling, numbness, and itching sensations. This is particularly common in individuals with vascular issues, such as peripheral artery disease, PAD, a condition where narrowed arteries reduce blood supply to the hands and feet, causing dry skin, irritation, and continuous itching. People with diabetes are also at a higher risk of developing peripheral neuropathy, a nerve damage condition that can result in itching, tingling, or burning sensations in the hands. Additionally, Raynaud's syndrome could be another potential cause, where blood vessel spasms restrict circulation to the fingers, making them cold, pale, or flushed red in response to cold temperatures, often accompanied by numbness and persistent itching. Observe other accompanying symptoms. If your loved one frequently experiences itching in their hands and wrists without a clear explanation, if joint swelling, stiffness, numbness, or muscle weakness also occur, it may indicate an underlying issue related to arthritis or circulation problems. In particular, if the itching persists or worsens, encourage them to seek medical attention from a rheumatologist or vascular specialist for a proper diagnosis and timely treatment. Early detection prevents severe complications and significantly improves mobility and quality of life. A seemingly minor symptom like itching can sometimes be a warning sign of underlying health conditions. Recognizing these unusual signs early can help protect yourself and your loved ones from potential health risks. 5. Itching in the lower legs and feet, a warning sign of poor circulation and cardiovascular issues. If you notice that your loved one frequently scratches their lower legs or feet without an apparent reason, don't dismiss it as a natural reaction or simply dry skin. In many cases, persistent itching in these areas can be an early warning sign of poor blood circulation, a common issue among older adults that often goes unnoticed. The circulatory system is vital in transporting oxygen-rich blood from the heart to the entire body, especially the lower limbs. When blood flow is compromised, particularly in distant areas like the legs and feet, the skin can become dry, irritated, and prone to persistent itching. This isn't just an uncomfortable sensation. It's an important warning sign, as reduced circulation means that tissues in the legs aren't receiving enough oxygen and nutrients. As a result, the skin becomes more sensitive, more prone to damage, and wounds take longer to heal. If this condition persists without proper management, it could indicate more serious health concerns. When the heart fails to pump sufficient blood to the lower limbs, tissues become deprived of oxygen, leading to tingling, prickling sensations, or persistent itching. One major cause is atherosclerosis, where arteries narrow due to plaque buildup, restricting blood flow to the legs. This can result in pale skin, chronic itching, and even numbness. Additionally, peripheral artery disease, PAD, a circulatory disorder that affects arteries supplying blood to the legs, can cause symptoms like pain while walking, cold feet, or slow-healing sores. Aside from itching, if your loved one experiences cold legs, swelling, leg pain when walking, nighttime cramps, or slow-healing foot ulcers, they could be dealing with venous insufficiency or a more severe vascular condition. These conditions not only reduce mobility and quality of life, but also increase the risk of stroke or heart attack if left undiagnosed and untreated. Pay close attention to any other unusual symptoms if your loved one is frequently scratching their lower legs or feet without an apparent cause. If they also experience swelling, numbness, pain while walking, or slow-healing wounds, encourage them to visit a cardiologist or vascular specialist for a thorough evaluation and appropriate treatment. Early detection is crucial, not only to prevent severe complications such as tissue ischemia, necrosis, or even limb amputation, but also to significantly improve quality of life. Small lifestyle adjustments, including a balanced diet, regular exercise, and proper circulation care, can help enhance blood flow and alleviate persistent itching in the legs. Never ignore the signals your body is trying to send you. Sometimes a minor symptom, such as persistent itching, can be the first warning sign of a serious underlying health issue that requires immediate attention. After watching this video, we hope you have gained valuable insights into recognizing hidden health risks and the importance of early detection. Minor but persistent symptoms, like chronic itching, may be an early warning of internal health problems. Attention to small, yet unusual changes can help you and your loved ones detect serious conditions early, allowing for timely intervention and better health protection. Taking a proactive approach to listening to your body doesn't just help with early disease detection, it also enhances overall well-being, reduces complications, and increases the chances of effective treatment. Never underestimate unusual symptoms, because one small action today could significantly improve your long-term health and that of your loved ones. Take the valuable insights from this video and apply them in your daily life to better care for yourself and your loved ones. If you notice any of the symptoms mentioned, don't hesitate to consult a doctor for professional advice and appropriate treatment. A healthy lifestyle, combined with keen observation and accurate medical knowledge, will empower you to take control of your health proactively and sustainably. Did you discover anything new in this video? Are there any symptoms you hadn't noticed before, but now realize could be more significant than you thought? Share your thoughts in the comments section below. Your experience might help others who are going through similar concerns. If you found this video helpful, don't forget to like, share, and spread this information to help more people become aware of these important health signals. Also, subscribe to our channel so you never miss out on valuable health and wellness content. Your support and engagement motivate us to continue delivering meaningful and practical knowledge that helps the community stay informed and take better care of their health. Thank you for watching, and we'll see you in the next video.